Why the term treatment-focused diagnosis? When I first went to the Medical University of South Carolina and was teaching dental students, when I went in and asked what the diagnosis was, I asked approximately 100 students what the diagnosis was. 45% said bone loss, 10% said calculus, 30% said plaque, and only 15% said gingivitis or periodontitis. And finally, when I asked what the treatment was going to be, regardless, the treatment response always was scaling and root planing. They had no way of knowing the difference between scaling and when you scaled and when you root planed, so I decided that I would coin a new term, treatment-focused diagnosis, or the TFD. And the treatment-focused diagnosis is found on the score sheet where students are given for the initial exam, and that's item number 4. You can go back to a video on the initial exam and have these other things explained to you. Now, determining a treatment-focused diagnosis, this is block number 4. There are 4 possible diagnoses that we can give. Certainly we could get into subdivisions on these, but we either have health or health with attachment loss, gingivitis, or periodontitis. So let's deal with health. Health is no bleeding on probing, no suppuration, and no pockets. The treatment, removal of supragingival plaque and calculus, and reinforced home care if necessary. There's generalized recession both interdentally and facially. Generally, this is a result of periodontal surgery. There's no bleeding on probing, no suppuration, and there are no pockets. The treatment on this is the same as it would be for a healthy mouth. But here comes the dilemma. You are scaling on a root, but generally in this situation, you're not root planing and smoothing the root. You're simply trying to get any accretions off. So given that, this is disease with attachment loss, and this is a periodontitis. Gingivitis. There is bleeding on probing. Suppuration, pus is present or may be present, not necessarily always. Pockets are present from swollen tissue, not from attachment loss. The treatment, scale and polish if it's slight to moderate. If it's gross, if it's severe and there's a gross amount of calculus, then you may want to do a gross debridement using an ultrasonic prior to doing scaling and polishing. And certainly you want to evaluate and give oral hygiene instructions, and certainly because this is a disease, you want to have the patient back to reevaluate and perhaps reinforce the oral hygiene. Now let's look at patient number 1. Patient number 1 has a slight generalized gingivitis. We look at that, and the treatment is scaling of the entire mouth and oral hygiene instruction and reevaluate. But this tells a student exactly what they're going to do. They're not going to need to do a gross debridement. They're going to need to instrument every tooth, and they know they can get a good result if the patient will practice good oral hygiene. So a slight generalized gingivitis is much more descriptive than saying a gingivitis. So let's look at patient number 1. They have a gingivitis. It is generalized. It is slight. In other words, probing depths are no more than 5 millimeters, and that patient with good home care and good instrumentation is going to get healthy and stay healthy if they'll follow the regimen. Now, contrast that with patient number 2. This patient has a localized gingivitis in areas 22 to 27. So this is the area where you're going to scale. But because this is localized and the rest of the mouth is healthy, then you're going to treat the rest of the mouth as a healthy mouth with a prophy and really focus your treatment on the lower anterior area. So this is what a treatment-focused diagnosis is all about. Now let's talk about patient number 3. This patient has a periodontitis. It is localized. It is slight. And look where it's located, in the maxillary molar areas. So the treatment-focused diagnosis on this patient would be a localized, slight periodontitis in the maxillary molar areas. Nothing is said about the rest of the mouth, so we can assume from this that the only area of disease is in these maxillary molars. The rest of the mouth would be treated as a healthy mouth with a prophy. But in this particular situation, what do we know from this diagnosis? We know that no surgery is going to be necessary, and we also know that this can be treated very successfully with non-surgical treatment using scaling and root planing. Let's look at patient number 4. Patient number 4 has a generalized slight periodontitis. By the treatment-focused diagnosis, we know that we're going to scale and root plane the entire mouth and then have the patient back for reevaluation. What else do we know? This is not going to be a surgical case, and you can reassure the patient on that. Patient number 5. This patient has a generalized moderate periodontitis. So there's nothing in the area on the right because this is generalized. Yes, you're going to be instrumenting the whole mouth, and with a moderate 6 to 7 millimeters probing depths, we don't know necessarily whether we're going to do surgery or not, but we do know that we're going to need to reevaluate for possible surgery. Patient number 5, a generalized severe periodontitis. This is a patient, in all probability, is possibly facing the loss of teeth, and all probability should be referred to the periodontist. We also need to evaluate bleeding on probing. And students used to say that the patient had bleeding on probing, whether they really did or not. But this makes them think. Slight is a trace. For instance, if you probe number 18 in 2 or 3 places and you get no bleeding, but by the time you get up to 20 or 21, a little blood has oozed out, that would be slight or a trace. Moderate bleeding on probing is spontaneous and indicates there's a greater inflammatory response. This would be a situation where perhaps you have a 5 millimeter pocket or probing depth, and as soon as you probe the depth of the pocket, as the probe comes out, blood oozes out behind it. Finally, severe means this is profuse and persistent. The tissue is generally quite inflamed, and before you reach the depth of the pocket, blood is flowing freely from that. And this is found also on the score sheet on the back. By using this, students at MUSC now have a much better understanding of what they're trying to accomplish with a proper diagnosis on this. So I would urge you to incorporate this in your undergraduate teaching, for I think this is proved by the basis of what we did at South Carolina to be very effective on teaching students to understand what it is they're trying to accomplish.